Welcome back, everyone. This is Sam.
And this is Karine, and we are Two Onc Docs.
So today we're going to be focusing on the exciting data coming out of ASCO GU, which is going to be February 13th to 15th in San Francisco. And so, Karine, I know you're headed to San Francisco next week, and the first day of GU ASCO is always prostate cancer. So tell me, what are you excited to hear about in the way of prostate cancer?
Absolutely. So, yes, we always start with prostate being Thursday. And so I'm excited to hear the final overall survival data for TALAPRO-2, which looks at talazoparib and enzalutamide in unselected patients. So as of right now, we have a lot of PARP inhibitors in this space, but only for a selected population of patients. And this regimen, the talazoparib enzalutamide, was FDA approved in 2023 for patients with HRR positive mutations. And we also have approvals for other combinations for BRCA1 and 2 for both olaparib and niraparib in combination with abiraterone, based on the PROPEL and MAGNITUDE trials that were presented at the same conference 2 years ago. And then we also previously had two monotherapy PARP inhibitors approved, olaparib based on the PROFOUND study and rucaparib based on TRITON2. And it's really important to identify which biomarkers were studied for each of these approvals, but I am looking forward to hearing more about TALAPRO-2, which will give us additional data on the use of PARP inhibitors in an all-comer population.
Awesome.
So that'll be very exciting. We're also going to be hearing about both a meta-analysis and a phase 2 trial for oligometastatic prostate cancer. So there's a lot of heterogeneity in terms of how these patients are treated. Sometimes we do radiation to the sites if there's a limited number of oligometastatic sites, and a more limited duration of intensified hormone therapy with ADT, abipred, extrapolating from STAMPEDE.
I think both those sound super exciting. I mean, PARP for all comers, that's awesome. I'm excited to hear about that data. And we always question, I feel like it's the tumor board discussion amongst all solid tumors is what do you do about the oligometastatic disease? How far do we go? How many spots do we hit? So that'll be exciting too. And I'll be excited to see what the parameters they use to call these patients to get them enrolled. And so what about radioligand updates in prostate cancer?
Yes, so this has been a really evolving field in the last few years. So we're also going to be hearing about PSMA-based therapies with combination sequencing paradigms, including some talks from nuclear medicine, which I'm excited about in terms of the radiographic criteria to assess response. Currently the standard of care is that we give 6 cycles of lutetium in the post-chemo setting, and then we stop and we monitor PSA to assess response. But I think there's a lot of interest in having more individualized dosimetry schedules for patients. So that's probably the future of where we are with some of these radioligand therapies. And we're also going to be hearing about ctDNA and the outcomes in metastatic castrate-resistant prostate cancer from the PSMA-4 study. And as a reminder, these were patients who received lutetium before taxane therapy, so additional data in terms of ctDNA in this space.